Hello, everyone. Thank you so much for joining us on this podcast episode. I'm Darleen with SeniorLivingGuide.com. If you enjoy our podcast episodes, we can be found anywhere you consume your podcasts, such as Spotify and Apple Podcasts and so many more. And also visit SeniorLivingGuide.com, where we provide seniors and their caregivers with a great resource to finding their next steps in senior housing and home health or healthcare services for home health opportunities. Please visit us on SeniorLivingGuide.com. And today in the podcast studio, we're super excited because our guests are Dr. Pam Tronetti and Janet Rooks. Dr. Tronetti is an osteopathic physician who specializes in geriatrics. Janet Rooks is a social worker and a dementia care specialist. They work together at the Parish Senior Consultation Center, where they focus on the care of patients with dementia. Dr. Tronetti is the director of aging services at Parish, and Janet Rooks coordinates Parish Senior Solutions, which provides education, resources, and support for seniors and their caregivers. Welcome, ladies.
Thank you. Good morning.
Good morning. So we're going to cover a topic that we have not even touched on in the over a year that we've been chatting about all these different topics that affect seniors so significantly. And it's one that really affects everyone, but seniors clearly much more significantly. And it's a very scary, scary topic. Mm-hmm. Everyone, when you hear it, it literally ignites fear in the heart. When you even just hear the word. I know that it does for me for sure. And that topic is cancer.
Absolutely, and
very fearful.
And when someone hears the word "you have cancer,"
mm-hmm.
you become a survivor.
Yeah,
and it's just really you begin your fight.
Yeah,
mm-hmm.
Yeah, and I don't think there's anyone listening to this podcast that hasn't had cancer affect their life in some way.
Absolutely. And what we're seeing, though, is cancer is much more survivable. Mm-hmm. We have folks come in as new patients, and they list 2 or 3 different cancers on their medical history.
Mm-hmm. Wow.
You know, I had this kind of cancer when I was 50. I had that kind of cancer when I was 70. And here they are at 85.
Mm-hmm.
And it's in the rearview mirror.
Yeah, absolutely. I mean, my grandmother, I'll tell you what, that woman lived well into her 90s, and she was the same way. She had several types of cancer. Well, one very significant one that no one thought she would survive in her early 80s, she did, and it was just absolutely amazing. So let's talk about cancer prevention, because I think it's always good to start with how to prevent certain diseases.
Well, I want to comment on one thing you just said is
okay.
She lived.
100%.
She lived into her 80s, 90s because she didn't sit down and just say, "I have cancer.
Mm-mm.
I'm going to sit here and just wait. I'm going to live my life."
Mm-hmm.
Diet is very, very important for anyone, but especially someone that has cancer, because you want to eat a healthy diet. We've talked about it seems like just about every podcast we do, we talk about a healthy diet.
Absolutely.
But it's very, very important if you have a diagnosis of cancer to eat a healthy diet and to keep your body healthy. Exercise. You've got to keep your body healthy. You've got to keep your body moving. Because you're fighting. You're fighting to keep your body going. Stop smoking. If you are a smoker, stop smoking. And that includes the vaping.
Mm-hmm.
People think that it's not, it's safer to vape.
Mm-hmm.
That vape that's going on, that smoky stuff that's going into your body is nicotine.
Mm-hmm.
So you're feeding your body, and if it contains formaldehyde and other chemicals. I don't know if it's listed on there because I haven't read it, but if it is, it's very small print.
Yeah, I think the vaping, for some reason, and maybe I'm completely wrong, when it started being introduced, I think they tried to sell it like it was a safer form of smoking.
They did.
Yeah, and it's a way to get off of smoking, which is a true statement.
Yeah.
But people think, oh, it's just water vapor. No, no, it isn't. And there's not a whole lot of FDA oversight, so you honestly don't know what chemical you're inhaling into your lungs.
Plus the fact that they've added so many different flavors.
That's what I was just about to say. The cotton candy, you really, and I think it's scary because it definitely entices younger not even smokers yet, but now it's a different type of thing. But that's a different podcast.
Well, they have changed the regulations to where you have to be 18 to buy it. And so that's great. It's better. Let me rephrase that. That's better because now you can't just walk in off the street. The younger kids can't just walk in and buy it. But it's really, really, it's toxic. It's going into your lungs, and there you go.
I think we'll see the full effects a half a century or a quarter century from now.
Yeah.
It's not as in vogue as people think it is.
Right. No, I agree with you.
Yeah. And you mentioned diet. There, on the American Cancer Society website, there are 12 obesity-related cancers that are associated. Esophagus is one, breast cancer, colon cancer, multiple myeloma, which is bone marrow cancer, essentially.
Wow. I didn't know that there was actually any specific obesity related.
There is, and the other part of this is we have a harder time palpating a nodule in someone who's overweight. Whereas I might find swollen glands in someone's armpit or an enlarged liver, I can't palpate that as one if there's layers and layers of the fat.
I've never thought about that, but man, it makes a lot of sense. It really does.
Yeah. So while we can have certain things we can do to help prevent it, also early diagnosis, and we have such great opportunities for cancer screening now. And I know with different types of cancer, they're adding more and more where, when you think about it, you think, oh, it's just like maybe breast cancer or colon cancer or certain things like that. But there's even more that they continue to add.
See, when I started doing medicine, you couldn't order any of this. It was you have to find a lump before you can get a mammogram.
Oh my
You
goodness.
have to have a GI bleed before you can get a colonoscopy. And now it's marvelous to me that you can get these done routinely, including, prostate cancer blood tests.
And we had this, go to a dermatologist. We're in Florida and, the Sunshine State. But that sunshine also, we're high rate of skin cancer. But the thing is, years ago, our suntan lotion was suntan oil. It didn't have the sunblock.
Right.
I can remember going on the roof when I was in undergrad, and we had our schedule based around the sun.
Yeah.
And you slather on the suntan oil or the baby oil and iodine, and and it was, you got that first burn, and then you peeled off, and then you worked on your suntan.
Yeah. We were so foolish.
Oh God, stupid.
Yeah.
But now it's like you use the sunblock, you use the and that sort of thing. So skin cancer, you go to a dermatologist to get a screening once a year.
Yeah.
And then when they find something, the basal cell or melanoma, as you mentioned, but there's other types of skin cancer. If they find something, then you go more often. But you need to go at least once a year to get a screening. Also, you have your dentist. They're going to check for any type of mouth cancer. Go to the dentist twice a year, because they're not just checking your teeth. They're also checking your tongue, your
Throat,
gums.
your gums.
Yeah, absolutely. Because tonsil cancer, they're going to be looking in there too, and they're going to be checking to see if there's any abnormalities. It's not uncommon to have something under your tongue, a little mole that may be a melanoma. And it's like, you're not going to look at that, but the dentist is.
Yeah.
And it's, it can change your life.
Yeah.
And if you do tobacco dip, you are definitely an increase for that, correct?
Oh, yeah, absolutely.
okay.
Or that little chew that you stuck in there,
Yeah.
this little pouch thing.
Yeah.
Oh, absolutely, because it's just sitting there. And it's, I don't know, it's gross. But anyway, that's
Yeah.
neither here nor there.
I-
But yeah,
I heard that.
It's here, so, think about it.
Yeah, definitely.
So I recommend people go on the American Cancer Society website, and there's a whole section on the guidelines for preventive testing. Right now, mammogram, now they're saying at age 40 you can start and get it once a year between age 45 and 54, and then over 55 every year or every 2 years. And I love this quote: continue as long as as in good health and expected to live another 10 years. So a vibrant, active 75-year-old, 85-year-old, go ahead and get a mammogram. The colon cancer screening, again, that starts at about 45, and follow up with a colonoscopy. You know, they'll change it. It's like every 5 years, but if they found a polyp or you're at high risk. And then things stop at 75 to 85, depending on your risk. The colon cancer DNA test, we've seen that advertised. It's kind of nice in between colonoscopies.
Oh, okay.
But there are false positives and there are false negatives. So you could have a negative test and still have a small tumor that just didn't get picked up. You can have a positive test, you're scared, but you go for the colonoscopy and you're fine.
Okay.
Lung cancer, people think that we get routine chest x-rays, and we don't. But if you were a smoker, and the guidelines were 30 pack years, which means a pack a day for 30 years or 2 packs a day for 15 years, you qualify for a CAT scan of your lungs to pick up the small tumors.
That's interesting.
You know, when I've talked to people, and I think the thing that they dread most about the colonoscopy is the prep.
Yes.
I mean, I've heard people just, I don't want to do that. I don't want to drink that stuff. I don't want to go there. So the prep is the worst part that I've heard people talk about. I mean, I've had a colonoscopy. It's a no-brainer, if you will. Get it done, people. Please get it done.
Yeah.
Talk to your doctor. It's done. You don't have to worry about it for a few years.
Yeah.
And it's peace of mind. Please get it done. Talk to your doctor, and if you're in that age group, if you have any risk factors, because that is a silent killer. It can be a silent killer. It's the one cancer that if you've got any polyps or anything like that, it can sit there. Please, 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 please don't be afraid of the prep. It's one of those things to where it's okay, you're home from work for a day, or you spend a Sunday afternoon at home. Please just get it done. The prep is, it's a pain in the butt, no pun intended, but get it done.
Look at it as a free cleanse.
Yeah. Yeah.
A
And when
free
you get on the
cleanse.
scales, you're going to be a little lighter.
Exactly.
But
exactly.
yeah, please get it done and don't dread it.
And that is actually the cancer that my grandmother had in her early 80s that they told her that they didn't think that she would survive from because...
Wow.
Yeah, and she did. But my grandmother was a Spitfire. She said, if I die, I die, and it is what it is. Because my grandmother, you could not keep her down. She was like go-go gadget. And she did. It never reoccurred. It never came back. And it was just... it was shocking.
And
for
you
all
had
of
her
us.
for so many more years.
We did.
Because she took control of her body. She took control of that, and she didn't. She didn't put her head in the sand. So kudos to your grandmother.
She never stressed about any of it.
Yeah.
She was just like, if it's time for God to take me, He takes me, and that's the end of it. And if not, I'm gonna keep rocking on. So
good.
Yeah. So what about Pap smears for seniors?
Well, what do Pap smears check for? They check for
cervical cancer. Not ovarian. A lot of people do think it checks for ovarian. I will tell you, I've had that feedback.
Well, then maybe you just saved a life right now today, because that's like a whole other level.
Absolutely.
Generally speaking, again, the American Cancer Society and your doctor can help you decide. What we've been saying is if you've had regular Pap smears, or if you had a hysterectomy and you don't have risk factors like cancer in your family, then you probably don't need a Pap smear after age 65. But it has to be individualized. Now, I'm going to jump into ovarian cancer just because you mentioned that. Yeah, because it's very sneaky. Often the first sign is nausea and vomiting. The diagnosis is ultrasound, to look at the ovaries, and then there's also a blood test. But it's not a good screening blood test. So you might say, why don't we just do that every year on everybody? It'll give you a lot of false positives, false negatives. So.
Yeah, it's a pistol, and that's why it's so sneaky. Is because I think a lot of times you're hitting a stage 3 or 4 without a lot of signs because there's no way to really pre-screen for ovarian.
And again, ovarian used to be a death sentence as soon as we made that diagnosis, and now we have treatments, and we have people in their 70s, 80s, 90s who are being treated, and it's being kept at bay.
Oh wow, that's amazing news. I love to hear that. So when do we stop the routine screening? I mean, is there a time frame where you start it like in your 40s or 50s, and then by the age of 70, you're like, well, I'm good to go, or 80, I'm good to go?
You know, some people or some patients and families choose to stop for personal reasons, financial reasons. But when they feel that the testing would overwhelm the patient, you know, we hear family members say that it's too much for them. You know, they may have dementia. It's just too much for them.
That's what usually keeps people from getting these things. Yeah, because they say even the testing would be overwhelming, let alone
going through a surgical procedure,
right,
or
chemo or anything
radiation,
that would,
or any of that type of thing. Other times they have a significant disease that would shorten their life, or you know, as I said, the cancer treatment in itself is so overwhelming, like the radiation, the chemotherapy. You know, I've often heard, you know, the cure is worse than the disease. Right. But in someone that is in their 80s, 90s, and they have another comorbidity, I won't say it's worse, but it can be devastating. Family members may say, no, we're not going to do that.
Right. That makes complete sense.
It does. But on the other hand, you've got to get your information. Because if you just say, oh, I'll bet the cure is worse than the disease, you may be wrong. Yeah. You may come to find out that they're going to give you a pill every day, and that's going to keep it under control.
Like radiation. Radiation is a pill sometimes, correct? Or am I misspeaking? I'm not for sure. That's why I'm asking.
Radiation is usually beam radiation. They have some prostate radiation seeds that get implanted, a few things like that. But no, there are pills, especially for breast cancer. Okay. The kind of anti-estrogen pills. The oldest one is tamoxifen. Okay. So get your information, get your knowledge, so you know what you're dealing with and what your options are and what to expect.
Yeah, no, that's 100%. I think you always have to weigh all your options before you choose to move forward or choose not to move forward.
And make sure you're getting that information from a viable source. You know, Google's good for looking up a restaurant and getting a map, but it's not always good for Dr. Google. Make sure you're talking to your physician, and they're giving you the good information, giving you a good source to find it. American Cancer Society is wonderful, but, you know, talking to your neighbor about their experiences, sort of thing. Just be careful. Be careful where you're obtaining your information, and, you know, like you said, Dr. Pam, weigh the pros and cons in this sort of thing, because, as I mentioned in the beginning, you become a survivor. And don't project what you think, your fears, your anxiety on someone else, just because.
Yeah, no, 100%. Talking to your doctor and then taking everything else out of the equation, I think is a very good idea, because I think we listen to all this, but you listen to social media, you listen to news reports, you listen to Google, WebMD, your neighbor who had a good experience or a bad experience or what have you, and it's very upsetting and can be very confusing, where if you're really just honing in and listening to your doctor, or if you want to get a second opinion, if you feel like that might be a good idea too, to talk to more than one doctor, then I think you can make a better, more informed decision than all this other stuff, which can tend to be junky.
Overwhelming.
Yeah. And it's not professional. It's not someone that knows your actual body, your history, have looked at your labs and really understand the disease itself. I think it's so important. So what are some of the signs or symptoms of cancer where, you know, you don't want to make people paranoid, because, you know, when you hear, you know, if you've been around someone with the stomach flu, the next day you're going, do I feel a little nauseous? Maybe I do, maybe I don't. And then you just start creating it in your own mind. So what are some of the like basic signs and symptoms that you might want to be concerned about?
Well, it's a sore that won't heal. You know, you've got this little scaly place on your leg that just will not heal. It itches and everything. Go to a dermatologist. You know, have them look at it, because you don't keep putting, you know, fungus cream on there. Go get it checked out. A lump anywhere in your breast, armpit, neck, testicles, get it checked. Lump does not mean that it's a fat deposit. Lump means you need to get it checked out. As you said earlier, it used to be that you had to have a reason to get these tests. This is a reason to follow up. If you find something, you go to the doctor for your physical once a year, you should be doing breast exams monthly. Men, you should be checking your testicles to see if there's anything unusual in them. Check your body. Your body. You should know your body. Anything unusual, let your doctor know. Get it checked out. If you've got blood in your urine or blood in your stool, that's a sign to go to see somebody. Tell your doctor, make a doctor's appointment, go in and have it checked out. That's not normal. That is not normal. That's a sign to get something checked out.
And there's a good chance, or there's a chance that there's nothing wrong with you. And then what ends up happening is, if you don't go get it checked out, if anyone is listening and they're like me, if I don't get it checked out, I stress and I anxiety and I check it out and I'm like, what's this lump? What's this? And it causes me so much stress and anxiety. And then I go in and get it checked out and they're like, oh, that's a little fatty deposit. And then all of a sudden it goes away, or the stress and relief just leaves my entire body. And I feel like all the world has been lifted. And I'm thinking, why didn't I do this 2 weeks ago?
Or 2 months ago.
Or 2 months ago.
Yeah.
So if you just go get it checked out, then you relieve all that stress and anxiety out of your life, and there's probably nothing wrong. But if there is, then you're catching it. I mean, you're nipping it in the bud and you're catching it early.
But there's that one time that you didn't do something, or that one person that didn't do something, and it is.
Absolutely.
It is something. So, Dr. Pam, what else are some of the signs and symptoms that you've seen over the years in your career, or you see now?
The blood in the urine, and especially the hidden blood, this is why you get a copy of every test they do, because I've had people say, well, they checked me for a urinary tract infection because I had blood in my urine, but the UTI was negative. There was no UTI, no urinary tract infection. Okay, then what caused the blood? Was it a kidney stone? Was it a tumor? You have to know. You always get that urine rechecked. They also spin it down and can look at it under the microscope, and they might find cancer cells, bladder cancer specifically. But a cough that just doesn't go away, get a chest x-ray. That's a start. Unexplained weight loss. And again, just because you're losing weight, it's not always cancer. Believe it or not, new onset diabetes can present as weight loss. Overactive thyroid, side effect of medications. Pain. I'm especially concerned about pain in the low back, because when cancers spread, like breast cancer, prostate cancer, just loves to go to the low back. So I want an x-ray to see if there's anything suspicious in that low back.
Yeah, that definitely makes sense.
You mentioned bladder cancer, and I learned this when I worked in the hospital. Smokers and bladder cancer. Smokers, you think lung cancer, but I would see patients being diagnosed with bladder cancer at the history of smoking. And so if you've got a significant history of smoking, and you stop and go, well, I don't cough, I don't do that. But I got, my urine is a little bit. Get it checked, absolutely, because it I don't know why, but it does.
Well, house painters and people exposed to a lot of fumes, paint fumes, different workplace fumes, are also at higher risk for bladder cancer.
I didn't know that.
Yeah. I know that because my dad painted houses for a living, hung wallpaper. So. It's always on my radar.
Yeah. Wow.
That's really interesting. And those are good notes to notate if you're in those types of fields, that those are some things you might want to be extra cautious about, for sure.
Yeah.
So I think we're going to take a break. And when we come back, we're going to talk about the workups for those types of cancers, or workups for cancers. Okay?
At Parish Healthcare, we believe in our community. We believe in keeping our community safe. We believe in the art of healing. We believe in healing patients, healing families, healing communities. We believe in the best and brightest working together for the common good. At Parish Healthcare, our team focuses on you as an individual because every life is a work of art to us. Parish Healthcare, where the art of healing comes to life. Visit parishhealthcare.com/healthaware for a free health risk assessment.
Hey, Mom, how's the retirement home search coming?
Oh my gosh, I'm just so stressed out. I don't even know where to begin.
Well, why are you so stressed? What's the matter?
I don't know where to find anything. I just need everything in like one place and know what all the options are.
Does the idea of searching for senior housing seem overwhelming and you just aren't sure where to even begin? SeniorLivingGuide.com has great news for you. We offer a one-stop solution to take the stress out of your senior housing search. At SeniorLivingGuide.com, both our statewide Florida edition book and website are created to make your senior housing search very easy for you to navigate. We provide details on communities, including retirement, assisted living, skilled nursing, memory care, and home health, allowing you to decide which best fits your needs and then connecting you directly with those communities. Visit us online at SeniorLivingGuide.com and start your search today and start de-stressing.
Welcome back. We are going to talk, like I had said, about the workups for cancer. So, Dr. Tronetti, what would some of those look like?
Well, I want to say sometimes it's kind of a surprise when you have cancer. Kidney cancer, lung cancer, some of these things have no symptoms. And then we have somebody come in and says, I hurt my shoulder. Oh, let's do an x-ray. And there's a tumor in their upper lung. Mm. But the workups generally are going to be, okay, there's something on your chest x-ray. Now we want a CAT scan. Now we want a PET scan, which will light up, if you will, in any areas that have a high metabolism, and cancer cells have a very high metabolism. Mm-hmm. There's specific lab work for what we call tumor markers. And of course, our oncologists have marvelous genetic markers and specific markers for tumor. Sometimes we find we suspect cancer based on basic blood work. And again, you want to get a copy of your blood work. A low sodium level can indicate lung cancer because of some changes with the metabolism with that. I've had folks who had what we thought was just a compression fracture from osteoporosis. Mm-hmm. But when you look at the blood work, the protein levels are high in the blood, and it's an abnormal protein from multiple myeloma, mm-hmm. From that bone marrow cancer. Mm. So, finding hints of a tumor is step one. Mm. And then, yes, CAT scanning, maybe MRIs, further blood work. Mm-hmm. Take a deep breath because you're about to go, through
a lot. Yeah. Mm-hmm. But it's really pinpointing where it's at and what type, probably.
Exactly, what type.
Right. So, I always hear PET scan mm-hmm. when someone is in the initial diagnosis phases mm-hmm. of cancer. I mean, that's used very commonly. Mm-hmm. And I didn't really understand why that was so used. So mm-hmm. kind of looking and understanding that it's because of the higher metabolic mm-hmm. rate, and that it shows as a bright spot in a PET scan.
Yeah, especially let's imagine you have mm-hmm. A spot on your lung.
Yeah.
Well, it could be a benign piece of scar tissue. Mm-hmm. People with rheumatoid arthritis and other inflammatory diseases will have multiple nodules in their lungs. Mm-hmm. But you do that PET scan and they don't light up. Okay, they're benign.
Right.
But if something does, and then you see something's lighting up in the liver and mm-hmm. something's lighting up somewhere else, then you say, okay, this looks like cancer.
Yeah, so that's a good way. I mean, when they do PET scans, do they typically do the whole body, or do they just focus in on an area that they have a concern about?
Usually it's from neck to thighs.
Okay. Interesting. So is there any one blood test? This would be so amazing. I don't know what the answer is. If you could just like every year go in, get a blood test, and it could say, oh, yeah, cancer, not cancer. Is there any type of blood test that provides, like, has cancer markers in it?
I wish there was one blood test that you could do. And it would show you if you have cancer anywhere. Yeah. Even the thought of, well, couldn't I just CAT scan from my chest to my groin once a year? No, because it would miss the head and neck cancers. It would miss the bone marrow cancers, the lymphomas. Yeah. So, no.
Yeah.
Yeah.
I wish.
So, what do you do when the diagnosis is cancer?
Well, when I worked in the hospital, I was the person that walked in after the doctor walked out. Or sometimes I'd walk in with the doctor because I, as the social worker in the hospital and working on oncology floor, I knew there was the diagnosis. And so I was there for education and resources and support. And it was, and yes, I carried tissues in my pocket because I was, the emotional support, not giving them my tissues, but having, because I was a very emotional person. I didn't go in there and cry with them, but if I needed to, I did. Yeah. You don't panic. If you're diagnosed with cancer, you don't panic. I was there to peel them off the ceiling or pick them up. You get support. I gave them information about American Cancer Society, what was available in their community, but you link into American Cancer Society. That 1-800 number that's there 24/7. And it's answered, the phone is answered by people that are cancer survivors or their family members of someone that's had cancer. They've been there, done that, have the T-shirt. And so they know what to expect. They've been there. You get a good oncologist.
Now, I wasn't sure I was going to share this story during this.
Okay.
But so my husband and I moved here to Florida. We're unpacking. We've been here a month. He reaches up to his neck and say, hey, honey, what's this lump on my neck? And I knew as soon as I felt it what it was. And here it was, tonsil cancer with some metastasis. So, I was hoping against hope, maybe it's just some lymphoma, which is sounds odd, but that's what I was hoping for. And they biopsied it. My soon-to-be friend ENT doctor came over, told me what it was, and I just about hit the floor. Right. They had to catch me because, it's easy to say don't panic. Right. You're going to panic.
Right.
Trust me.
Yeah.
Right.
Because when I was in training and a younger doctor, head and neck cancer was 100% death rate. I took care of people that had the cancers. It's squamous cell, by the way, which is also a type of, it'll get on the skin and make these little rat-eaten lesions. It would eat its way through the person's cheek. Or they would do what's called a radical neck dissection, take off half the jaw, the face, the neck. Yeah. That's what I had envisioned. It was several months of nightmarish treatment. My husband had a feeding tube. He was in the hospital half a dozen times, last rites, those kind of things. He got through it. He's and then what else did we do? We reached out to the oncologist. We reached out to the cancer support group of other people going through cancer treatment. And then he returned the favor. As when he got through it, he was a mentor for other people who were facing this.
Yeah. So, when my mom did pass away of ovarian cancer, but she lived 8 years. And we did have, in the very beginning, a lot of really good years. I almost actually forgot she had ovarian cancer because she was in remission for a long time after her first initial diagnosis and treatment. But I think my mom panicked less then. I think my mom knew she had it prior to, I don't know. I think she knew. She went in for a cyst removal, but I think she knew it was more than that. And I think sometimes the family panics more than the patient. So it's more keeping the family in a check. But we did see, and I think our doctor was he told us to expect 5 years. I think being honest and expectations is very, and enjoy that quality of life that you have, even if it is a diagnosis that is what ours was, which can happen for sure. but they did come a long way in the years that my mom had ovarian cancer. And even you mentioned they've probably even come farther. And I actually have a girlfriend that had the same, almost exact same scenario that happened with her, and she's in remission, and they told her that she probably will not, that her expectation is she will not get it back. She feels like that she's permanently, she doesn't have a it will not affect her the way it affected my mom. I don't know how to put that in a different way.
She's kind of sort of been given a cure.
Yes.
It's like you're cured.
Yes.
But you're always on the lookout.
Yeah.
She definitely is.
Has a little twinge, then it's, that thought comes to her mind.
100%, because I've talked with her. But she's, so it is definitely something that I feel like they've made headway with even since then. So I think before you panic, definitely...
Or right after you panic.
Okay, because you are going to panic.
Yeah.
But yes, for sure. So what if a patient says, if I have cancer, I wouldn't do anything about it? Because I will tell you, my mom did say that. Because my mom she was so afraid of the treatments.
And take a deep breath, get the information. So just because you say, oh, if I have cancer, I'm not going to do anything about it, doesn't mean the cancer is going to go away.
Right.
It is going to hurt you.
It also doesn't mean you're not going to do something that next breath. You made that initial response, maybe, or before, I'm not going to do anything. And then, because it's like, all it flashes, all these things go through your mind, and it's just what happens.
Absolutely.
Yeah, you have to be Mr. Spock. It's all about logic. It's all about taking notes. It's all about risk and benefit and options. Cancer treatment has come such a long way. We used to remember the old cobalt treatments that the people got so sick. Now it's targeted beam radiation that you go for your radiation treatment and then you go to work. The chemo and treating the side effects, much more tolerable now than it used to be.
Yeah.
And you don't want to wait until it's too late and then say, you know what, I really should have put up with 3 months of treatment. Now it's too late for anything.
Right.
And and I hear people say, well, I don't want to lose my hair. It's just hair. It's just hair. It's going to grow back, and it may grow back curly. It may grow back a different color, but it's just hair.
They make some, and a lot of people will want to do like the wig thing, but I will tell you, the scarves on ladies' heads, or even, well, I don't know, men can do bald all day long and they still look amazing. Actually, a bald man is really usually very sexy, in my opinion.
They have a higher level of testosterone than men who are not bald.
There you go.
There.
But women with scarves on their heads, I think they're so beautiful.
I have seen some pretty women that are bald.
Absolutely.
That are going through treatment, cancer treatment, or have just gone out there and shaved their head. They're rocking it.
Yeah.
They really are.
Yeah.
And it's all about the makeup, just how they're carrying themselves.
Yeah.
And it's all about acceptance.
Yeah.
It really is. And it's all about acceptance. And sick from the chemo, but put your makeup on, put your lipstick on, and rock it.
Absolutely.
It's just hair. It's going to grow back. It will grow back. But that treatment is a hard decision. It really is. And it's a decision you're going to make from your heart. It's a decision you're going to make from your gut. And it's a decision that you're going to make with your doctor. You're going to make that decision. But it's your decision. You weigh all your options. For example, lumpectomy and a pill a day, your treatment with the side effects. You're going to weigh what the side effects are going to be. You're going to talk to your doctor. You're going to find out what's in your best interest. You're just going to do that. Patients with a level of dementia and other illnesses, they may or may not have the treatment, but that's something they're going to talk to the doctor about. Just because you can doesn't mean you will.
Right.
Or you should.
There may be 2 or 3 options of treatment.
Exactly.
One is more aggressive, less aggressive, and you might say, well, the less aggressive sounds easier to do, maybe a higher risk.
Exactly. You know.
Yeah. So is anyone too old to consider cancer treatment?
No, no, they really aren't. You know, we've had patients in their 90s that have gone in, had a mammogram because you found something, and then they had a lumpectomy or had their breast removed, and there's no follow-up treatment, and they're fine.
Yeah, and oftentimes we'll say the cancer cells are actually growing more slowly. The younger you are, often the tumors are more aggressive. They grow faster, they spread faster. So you have a little more time to remove the tumor and say, oh, I got it all. There's no other spread because it's been growing slowly.
Oh, did not know this. So, not that I want to sound like this is a morbid question, but I think it's something that can, it's a little bit confusing because you die of cancer, but sometimes do you die of cancer, and how does cancer actually kill you?
Okay, cancer cells are abnormal cells. So that's how we know what kind of cancer it is. We have back pain, we do a biopsy, and they say, aha, this is breast cancer, this is prostate cancer, this is liver cancer, because those are what the cells are. They are replacing the healthy cells that usually would do the organ's job. So now if your liver is full of tumor, you have no healthy liver cells doing their job. Or the lungs. If the lungs are full of tumor around the airways, then you're not getting enough oxygen in. That being said, because they're abnormal, they can bleed, they can chew into blood vessels, they can cause a bowel blockage, which results in gangrene and bowel obstruction. And so that's like a secondary way that they kill you.
Yeah. So do we ever not tell people that they have cancer? I mean, is that something that you've...
That was the old paternalistic, I know what's better than you. It'll upset them if we tell them that they have cancer. Yes, it will. But sometimes it's the family who doesn't want to deal with a sad or upset loved one. Janet, what do we always tell people?
They'll find out.
They will.
Trust me, they'll always find out. The church prayer chain, the nosy neighbor, somebody, they'll either send them a card, a get well card, even if they're in an assisted living facility, the word gets out.
Right.
And it may be a family member that lives way out of state. It ends up they will find out.
It's not something to be ashamed of, so it shouldn't be something that you want to. I mean, I don't know. I don't know if people don't want people to know because they don't want people to feel sorry for them, or
no. It's usually the family are worried that it'll make mom sad, it'll make mom upset. Now, maybe back in the day when there was no treatment, it was okay, live your life happy. But I think most of us would want to know. So we could go to Disney World, or we could write up our will, or we could sell the house, or we could do what we want to do. Everybody deserves that choice.
I agree.
I think it's a layer of protection. It's like, too. Okay, we're going to protect Mama, and we're not going to tell her. We're going to protect Daddy, put this cocoon around her, and we're not going to go through that cocoon and tell them anything that may cause them any sadness. You know, and we see it. We also see it with, you know, diagnosis of dementia or diagnosis of anything. Let's just tell them that the world is wonderful, and here's their rose-colored glasses, and, you know, no, don't tell them anything.
Now, certainly, because I've done this before, you know, the doctors are the best ones to say, I've got tough news. Let's spend some time. I'm going to tell you something. Half the time the patient says, I have cancer, don't I? I knew I had cancer. And then you talk about, yes, you know, we found this, it's a tumor, and these are our options, and this is what we want to do. The flip side of that is some patients don't tell their families they have cancer. Again, it's not fair.
Yeah.
You know, everybody deserves to know, even if it's upsetting, which it will be.
Yeah, and they may say, okay, what are we going to do? You know, and the family's sitting there, tears just strolling down their cheeks, and the patient goes, okay, what are you going to do, doctor? What are you going to do? How are we going to take care of this? Who do I need to see next? And even with having some memory loss, it empowers them. Okay, what are we going to do?
Right.
And and the daughter's sitting there with just broken hearted,
right?
And it's like they put on their peacock feathers and they're ready to go.
Yeah.
So it's because they
And
knew something was wrong.
Exactly. And very, very rarely somebody has such severe dementia that it makes sense to not burden them. But they're going to figure out, why am I going for a CAT scan every 6 months if there's nothing wrong with me? So again, we might say, yes, there's something in your lung. We don't know if it's cancer, but we keep watching it. Okay.
Yeah.
Because that way it's not somebody walking in saying, oh, I heard that you have cancer. What? You be upfront with people.
Yeah. You have to have some level of honesty, regardless of cognitive decline.
Yep.
Yeah. Well, this was really informative. I'm glad that we were able to touch on this topic today because I think clearly it affects every American in every aspect of life from young to old. And there's so many questions that we always have, and we really don't know sometimes what the answers are. So this was a really great podcast. So I really appreciate you coming in and sharing your expertise with us today.
Thank you. Happy to be here. And I think we told people just, confront this.
Yeah.
Be strong, be brave, don't lose hope.
Not at all. And it's people all over the world.
Yeah, absolutely. And Janet, you never lose hope, right? You
Absolutely
always
not.
Keep
Don't
on,
lose that hope.
Keep on trucking. So, well, thank you everyone for joining us. If you enjoyed this podcast, we can be found anywhere you enjoy podcasts, SeniorLivingGuide.com. Have a great day.